that IUD can be fitted at any time as long as you are not pregnant? Remember, IUD can also be fitted just immediately after delivery. Hey lovelies, welcome back to the Nursing Moms. I'm Nurse Janet, for those who don't know me, and in this space here we talk much about family planning, breastfeeding, antenatal, postnatal, labor and delivery, anything to do with a woman's health. Yeah, in today's video I'm going to share with you facts that you should know before taking an IUD as a mode of contraceptive. Personally, I love intrauterine device for several reasons that I'll share with you. First, let's see what is an IUD. IUD actually stands for an intrauterine device, and this is exactly how it looks like. Yeah, you can see exactly fits inside your uterus the way it's fitting it here. Personally, I'll tell you the very good reasons why I love IUD. Before I move to that, let's see how IUD works. And we have two different types of IUD. Remember, did you know that we also have hormonal IUD known as Mirena? It's not only copper T, there is also hormonal. Copper T is non-hormonal IUD, but we equally have the IUD that has got hormone in it, especially the progestin hormone. Yeah. Actually, how they work depends on which. We'll start with the hormonal one. The hormonal one has a coating of hormone known as progestin hormone, and this hormone is released in very small bits. It's very little compared to what the daily oral contraceptive pills releases actually. And this is hormone progestin. If you can review the previous videos that I did about hormonal contraceptive, the hormonal contraceptives almost works the same. This hormone will be thickening the cervical mucus and preventing the sperm from penetrating through it to swim upwards. Yeah, that is how it prevents pregnancy. Remember, for a sperm to swim upwards, we must have a very good environment like the slippery cervical mucus. But again, with hormonal IUD, it makes the cervical mucus thick. That is how actually it works. While the copper T, the non-hormonal IUD, works by being a barrier. Actually, the copper itself creates a very toxic environment for the sperms to survive. The sperms cannot survive in copper. Copper kills the sperms. And again, it also works as a barrier. Suppose fertilization had already taken place, it will prevent any space for implantation. It works as a barrier by preventing the sperms to swim upwards. That is how these IUDs work. Why would I advise anyone to have an IUD? IUD is known to be one of the most effective mode of contraceptive, at 99% effective, compared to these other methods that are not so reliable, and again compared to these other methods that maybe you would want to take like daily. And again, IUD is also known as the LAC, the long-acting reversible contraceptive. It's not only a long-acting, but it's also reversible. It's not a permanent method. Remember, you can have this for 3, 5 to 10 years. That is quite convenient if at all you are planning to have good spacing for your kids. And unlike these other methods that maybe you really need a constant reminder on when to take the pills or like injection after every 3 months, no. This is once you put it, forget about it, up to 10, even 10 years. And again, another good thing that you should know about IUD is that it has an immediate return to fertility. You can remove it at any time. Suppose you got an IUD that can last up to 10 years, but after 3 years you need a kid. Actually, you'll walk yourself into the facility, get it out, able to get pregnant just immediate, compared to maybe Depo-Provera that might last for some time. This is one good reason why you really need an IUD. And one of the very best thing to know about the hormonal IUD is that it also regulates heavy bleeding. Yeah, to those women who always have heavy bleeding, if you get yourself an IUD that got hormone in it, that is the progestin hormone, remember, you will either be seeing just a spotting or not seeing your blood at all. I think that is a good reason. And another beautiful thing is that to those women who cannot tolerate hormonal modes of contraceptive, you got yourself copper T. The copper IUD has no hormone in it. So at least there is a solution that you really don't have to burden yourself with the hormones and the side effects of the hormones. And you can imagine those women with complications, and again, they cannot tolerate hormonal methods, but again, they have to do family planning. This is where copper tea comes in. IUD is equally good for our girls, maybe those who have not yet given birth. Yeah. Unlike these hormonal methods, you can get yourself IUD. Remember, maybe you are still in school and you're planning maybe after 10 years to get a kid, and you are sexually active, you cannot abstain. You can actually get an IUD inserted. And again, by the time you'll be wanting to get a baby, it's easy to remove. The only challenges that we get with the IUD is that suppose you had heavy bleeding, then it's not suitable for you to use the copper tea. It can worsen the situation. And again, the fear of IUD worsening the situations of maybe conditions like pelvic inflammatory conditions. Remember, before an IUD is inserted, there is pelvic examination that should be done. So if at all it's not suitable for you, the healthcare provider will tell you, no, this is not the best method that you should really use. IUD also doesn't prevent sexually transmitted infections, so it's quite important that you combine either IUD with condoms for you to get fully protected, maybe for the sexually transmitted infections. And another challenge is that IUD requires a health personnel to have it inserted. You have to visit a healthcare worker for you to get your ID inserted. And another challenge that you can get with IUD is that you will have changes in your normal menstrual periods. I told you previously that if you will be using a copper tea, then expect changes in bleeding that can be maybe heavier if at all you are a heavier bleeder. But again, these things always comes back to normality after some times. The beautiful thing is that if you were bleeding heavy, you can use the copper, not the copper actually, you can use the hormonal IUD. After putting an IUD, mild cramping is also expected. Actually, you'll feel like you're having some cramping. It's quite normal, but again, these two will go away after some times. What are you expected of after an IUD insertion? You have to check on the threads. Yeah. The threads must be felt like after every menstrual monthly period. And again, the fear that maybe your male partner will feel the threads during sexual intercourse is just but a myth. They can never be felt. The threads are very, very soft and they can never be felt. And again, even if they feel them, it has no impact on your, the pleasure will just go on as okay. If you are using the copper tea IUD, then after insertion, it works immediately. Yeah, remember, after insertion, this works immediately. While if you are using the Mirena, the hormonal IUD, then after insertion, you have to wait for about 7 days for you to engage in unprotected sexual intercourse. But again, you can actually use condom in between before the 7 days. And lastly, did you also know that IUD can be used as a mode of emergency contraceptive? I think I've talked about this before. You can link to my previous video and know how you can use an IUD as a mode of emergency contraceptive. So far so good, IUD is one of the very best mode of contraceptive. Thank you.